Hello, and welcome to the third and final Race CE webinar hosted by Probo Veterinary and Mindray Animal Medical. I am Jennifer Winston, Application Specialist for Mindray Animal Medical. And just a few housekeeping notes before we get started. The webinar is being recorded, and so have the prior two if you want to watch those on the CSU Vet CE website. They can be viewed by anyone at any time free of charge. Your microphones and cameras are disabled for the duration of the webinar, so don't worry about being accidentally seen or heard. And that being said, please feel free to submit questions to the speaker during the presentation in the Q&A window. I'll kind of help moderate that, and you'll find that window by hovering your mouse over the bottom of your Zoom screen. I'll be asking our speaker to answer as many questions as possible, possibly during and definitely after the webinar. We will be giving away some Mindray swag. We have some Mindray animal brick sets and that we will pick for any new follower on any one of the three social platforms. So please use the QR code. I'll put that out on many of our slides. And most importantly, I really would like to thank Dr. Carroll for his time and intense knowledge. So just a little history about Mindray Animal. The Mindray Group was founded in 1991 and is one of the leading global providers of medical devices and solutions. It's firmly committed to our mission, and we employ advanced technologies and transform them into innovations adapted to various clinical scenarios. We serve over 190 countries and regions around the world with 21,000 employees, and close to 4,000 of them are R&D engineers who explore the most advanced medical technologies. Just over 6 years ago, Mindray Animal Medical was established to solely focus on animal medical technologies, integrated R&D, manufacturing, supply chain management, marketing, and focusing on customer service and training in one prestigious brand, all focusing on animal health. We are growing so fast that we're already building our new global headquarters of Mindray Animal Medical, and that will be completed by the end of 2027. We have 10 R&D centers around the world, with 3 of them in the USA, Seattle, Silicon Valley, and New Jersey. And we just opened our first veterinary education center located in Finland. Our medical imaging solutions range in size, shape, and function to support all companion animals, such as felines and canines, as well as farm animals, equine, exotic animals, and even lab animals for scientific research. From the beginning of product design, we have fully considered the needs and clinical diagnosis, treatments, as well as the animal's welfare. Our transducer solutions are designed to meet the needs of large and small animals. And at the same time, diversifying monitoring accessories can be applied to the different patients while protecting their delicate skins. The Vetis 9 is the very first veterinary cart-based with the E7 portable-based color Doppler ultrasound system equipped with the ZST platform. ZST platform opened a new era of premium ultrasound imaging and supports various high-end clinical scenarios. I would love to introduce a great friend and just a wonderful clinician. Dr. Carol Loyer is a DVM, is board certified in cardiology as a diplomat of the American College of Veterinary Internal Medicine. He received his Doctor of Veterinary Medicine degree from Colorado State University in 1986, followed by an internship in medicine and surgery in Santa Cruz Veterinary Hospital, and finished a residency in cardiology at the University of California, Davis. Dr. Carroll has been in general practice, ran emergency hospital, practiced referral internal medicine, and has been practicing cardiology and respiratory medicine since 1989. He's seen over 17,000 cardiology patients and performed over 10,000 ultrasound exams. Dr. Carroll hopes his career of clinical and ultrasound experience expands the capabilities and productivity of other clinicians and sonographers and positively impacts the lives of patients we treat.
Wonderful. Good to be here. I'm excited, and we're going to talk about ultrasound as the new stethoscope. And really, I'm going to take you on a guided tour of veterinary ultrasound because it's kind of the Tower of Babel in what are we doing with ultrasound and how do you progress through ultrasound and what are the different parts of ultrasound. So I've tried to address that, and I'm going to lead you through that whole scenario and show you how ultrasound really it doesn't replace our stethoscope, it adds to our stethoscope, but we certainly are less reliant on our stethoscope. And that's where we're going to go with this. And then I would add, thank you, Jennifer. I've worked with both Mindray and Probo. I bought a machine from Probo, and they've been wonderful to work with. And Jennifer's, I've looked at Mindray's equipment. It's really remarkable, and so I'm a keen supporter and very much think they're both great companies. I think the thing that I wanted to take home was that I've been doing this for 40 years. I was the first student to take ultrasound courses at CSU. I love CSU and still go there to take courses. And 40 years ago, long ago, one of my friends said, "Hey, wave of the future." And somehow I woke up and petitioned them to be able to take an ultrasound course from somebody who was willing to give it. And here we are 40 years later, and I'm still passionate about veterinary ultrasound and want to help you to do veterinary ultrasound in your practice all the time is the way I see it. And I recalculated that. It looks like I've seen over 65,000 patients. That's a lot of stuff. That's a lot of exams. So I have this stethoscope. It's the newest, fanciest stethoscope. I love this stethoscope, but I rarely use it in that mode. It just takes too much time to get it set up on my phone and do an EKG when I can do that in other ways. But I'll tell you, I do a exam, I do a stethoscope, I do a physical exam, and then I ultrasound them. I reach for a probe, and these days the ultrasounds are amazing. So let's just go and see what all this looks like. So the quick exam is amazing. So it gives you instant answers. So here's a dog with pericardial effusion. You can see the fluid in the heart sac, and the heart's all contracted down and tamponaded. And that was an instant reveal of what was wrong with this dog, who's just kind of ADR. I don't think we're supposed to say ADR anymore, but you'll forgive me. So what I want to do is I want to share with you how we go from fast exams to point of care exams to advanced exams. What does that look like? And how are we going to integrate that into our practice on a daily and even patient by patient basis? The other thing I really want to do is empower you. I want you to take something home that you can use to help in your clinic to do this. So this is not just a talk, but an empowerment of you to be able to do this. And these are questions that we're going to want to answer. The primary roles of FAST and POCUS, what structures in a basic exam, what situations can point of care ultrasound be helpful, what should you look for in a normal ultrasound echocardiographic finding, and how does this improve patient care? By the end, these questions should just be self-evident to you. So once upon a time, that's how all good stories start. Once upon a time, and this isn't a Prince and Princess story, but it is about ultrasound. So there was a FAST exam, and that was born out of human medicine from trauma, and they wanted to detect free fluid. We adapted that so that we're looking in the abdomen for hemoabdomen, and this is from trauma-based or uroabdomen and pericardial effusion. Again, this was first adapted for trauma. So what is a fast ultrasound? That can just be thought of as just looking for effusions. That's all we're doing. Effusions in any of the body cavities, abdominal, pleural, or pericardial. Pneumothorax turns out to be kind of hard to do, as is pneumoabdomen. So I'm going to eliminate that. That's not really in the purview of what we want to do with a fast exam. We just want to look for effusions. I'll come into this here in a second and show you how I'm going to help you with that. So we'll do a 4-quadrant exam of the animal, and we'll just start up in the subxiphoid area. It's been called the diaphragmatic hepatic view, but it's subxiphoid. I like this literature better because it tells me where to go. But we're going to look at the diaphragm and the liver through this view, and then we're just going to go clockwise to the splenorenal view, or the left paralumbar. And as you might imagine, we're going to be able to see the spleen and one of the kidneys, left kidney here. We'll just keep going back to the urinary bladder, and we're going to take a look at the urinary bladder through this view, the one we do all the time for cysticentesis, no big deal. And really, I want to make it that all of this is no big deal. It's no big deal to pick up an ultrasound probe and do an examination, and I'll try to help you with that. Here's the hepatorenal, and as you might imagine, now we're going to see the liver and the right kidney. So that's where we're going with all that. What are we looking for? Fluid. That's all we're looking for. In the abdominal, we're looking for free fluid in the abdomen. Easy enough. It's a hypoechoic and it's easy to see. This becomes just a normal thing for us to see on an abdominal ultrasound with free fluid. Or if we peek through the liver and the diaphragm right here, we can see free fluid in the pleural space. And here's a collapsed lung lobe that we're also seeing. And so we've now identified pleural effusion through that one view. We can switch over to the right side, which is where I live because I'm a cardiologist. I rarely look for pleural effusion this way. I look at it this way. And we've got pericardial effusion here. Here's a pericardium here, pericardial effusion here, left atrium, left ventricle, aorta, something in the right side, probably right ventricle there. And easy enough, really quick. So here's where I want to help you. I'm going to give you something. It's free. You don't have to pay for it. And this is a program that I've written, and it is free to you. Go to echovet.com, and then you just sign up and do all the stuff it takes to load thousands of presets for you. This is all loaded, and you can use it for free. There's 10 free exams. I'm going to show you how to rip off the system, but don't tell the me who actually built this thing. And I'm going to show you how to keep using it for free so that you can learn from it. And that's what I want. I want you to be able to learn veterinary ultrasound. So we're just going to put in some required fields here. And then you'll create a new exam, and you will just keep reusing this exam. You get 10 free ones, so you can try another species, canine or feline or equine, and then keep using the exam. So just come back into the exam you've already created, and this will show you the basic setup of veterinary ultrasound. We've got fast and point of care. We have basic ultrasound, both abdominal and thoracic, and then a complete abdominal ultrasound set and thoracic ultrasound. If we come to what we just talked about, fast, in fast we have initial and serial that we can do. And I've given this dog, I've put some stuff in here. He's in right lateral recumbency, which is preferred. If we're going to do thoracic, we want him sternally so we don't stress them out. And then we've just said what we've found in the subxiphoid position, left paralumbar, urinary bladder, and right paralumbar. We've added those up. And the program will help you analyze that. So if this is trauma, you can say, oh, there's an effusion score in trauma, and you can just use that, and it will automatically put that in a report for you. So that's very quick, and the report is instant. And we're going to go here and look for pleural effusion. We're still in the subxiphoid. It was mild. we've found mild effusion in the right thorax and none in the left thorax. We're just telling what we've seen, and these are all drop downs, so this is very easy. So you should be able to go through and do this very quickly, because it's not enough to do the ultrasound. You have to report it. And for me, this is much faster. So I'm going to show you this as we keep going along, because we're going to go to point of care ultrasound and pulmonary and lung ultrasound. That's the next thing we're going to show. So let's go back to our slide set here and play that. So that's all free. You can just use that. And download it, just follow the web, go to echovet.com and just use it for free. If it really helps you and you start using it, it's really inexpensive to use after that. So POCUS, point of care ultrasound. This is how we make real-time decisions on animals that we're seeing. And we're going to now expand the FAST exam, and we're going to now check bladder, heart, lungs, and abdomen. And we're just doing something in addition to the FAST exam. This is quick. This is all very quick. And as you guys get more comfortable with it, you'll have more confidence in what you do, and you'll do it very, very rapidly. So that's where what I do, my exams are very quick, but I've done a few of them that you might have seen. Okay, so if we do a POCUS, a point of care ultrasound, we're going to do the abdomen. We're also going to do pulmonary and lung ultrasound. And that's kind of a new one, but it goes along with point of care. And then we're going to do a cardiac point of care. So let's take a look at some of that. So if we do the abdominal point of view, we're going to look for abdominal effusion, which we already did with our FAST exam. And now we're going to also evaluate just these things: urine production, gallbladder halo sign, and renal pelvic dilation. That's the only things we're evaluating with a point of care. So it's very, very directed. Once we get beyond that, we start getting to basic ultrasound, but point of care is just these 4 things. And I'll show you that. So we've got some, again, some free fluid in the abdomen with the liver, so hypoechoic fluid. This is we've now gone to the bladder, and the only thing we're looking for urine production is, are we producing urine? And if we repeat that, we can say this animal is producing urine or not. It's very easy. We're just looking at general big things of the bladder. Is it filling or not? The gallbladder halo sign, and I'll show that to you here in a second. The gallbladder halo sign is where the gallbladder wall is edematous, and that's a sign of either right heart failure or anaphylaxis. I'll show you that here in a second, but that's what you're looking for with the gallbladder halo sign, and then I'll show you renal dilation. So let's see where we're going here. I think I'll do that. I think it'll be easier for you guys if I just pop back here, because we're going to do the abdominal effusion. We already did that. We already filled this out because we filled it out in our FAST exam. We didn't have to really do anything else. Urine production, all we're doing is saying, well, it's got a moderate amount of fluid, and we think that urine production is normal, or we're going to say something else, again, with pop downs. And gallbladder halo sign, we looked for that edematous gallbladder, and we see it, and then we can, choose this, and this is what it means. And so that's a really quick thing. And again, I just want to reiterate that you guys can just use this, and it's a great learning tool. Just use it to learn a bunch of stuff, and I'll show you as we go along its value. And then renal pelvic dilation, there's mild renal dilation, and in this case, it's consistent with fluid administration. It's not pyelonephritis. Okay, so I'm just going back and forth to kind of show you, and now we're going to thoracic, lung, and pleural and lung ultrasound. We'll just come back to here. I know we're jumping back and forth, but I wanted to give you a tool that you guys can use when you leave this webinar. You can use this in your practice to keep learning. So in this case, once again, we're looking for thoracic effusion. We've got this dog in sternal, either standing or lying down in sternal recumbency. Makes it easy to do. And we're going to also look for alveolar interstitial syndrome, which is basically looking for pulmonary edema. And subpleural lesions are masses, generally pleural thickening. It's a little harder to do, but masses that you can see by ultrasound. And here's the alveolar interstitial. We're going to look for these B lines. These B lines, or lung rockets, are a sign of either pulmonary contusions or a sign of pulmonary edema. That's what we're mainly looking for. We've got pleural effusion. We were doing it from the right side, so now we can see a little bit of pleural effusion before we get to the heart. See that? So you should be able to see that. And I'll go through that again. We'll switch over to EchoVet here in a second. So now I'm going to add on cardiac point of care. There's only a few things in cardiac point of care. We're keeping it very simple. So these are things that you will be able to look for on a daily basis. Easy stuff is what I'm trying to make this for you. There's pericardial effusion. Once again, we're looking at effusions. We've already looked at this with our fast ultrasound, which expanded to our point of care ultrasound, and now our cardiac point of care. We're going to look at contractility, volume status. So are they dehydrated, not hydrated because they're septic? And we want to look at left atrial size, because if we look at left atrial size, what we're saying is, do we think that the dog is breathing hard because of respiratory disease or heart disease? Almost all heart disease that's going to cause pulmonary edema, left atrial size will be increased. That's not totally true in the case of a ruptured chordae. That may not be true, but almost always that's true. So let's just take a look at that. We'll come back out of here and see how that pans out on a practical basis. So we've got thoracic plus. We looked for pneumothorax. We didn't look for pneumothorax because I think it's hard to do. I would encourage you to do x-rays for pneumothorax. We're looking at the alveolar interstitial syndrome, which is basically we're looking for pulmonary edema. And we're looking at these lung rockets. So we're saying, okay, yes, they're present. They're in the middle third of the chest. They could be in the ventral third or the dorsal third. You know, if they're the higher up they are, the worse they are. And then we've got, what does that mean? And we just said, okay, now we know what it means. That we've ruled out pneumothorax. We've suggested pulmonary contusions or interstitial edema, whether it's cardiac or non-cardiac, and we can use that in our report. So we can do the same thing. This is doing the same thing, but from the left thorax. And is there a subpleural lesion? I don't really do step signs, and I don't memorize all that. I can just look at an ultrasound and know what it means. I'm not really doing that any longer because I'm used to seeing what I'm seeing. And so now we're able to say something about it. And these are the things you can see with this view. If we go to cardiac point of care now, once again, we've already said that we don't have pericardial effusion. What about contractility? Well, if it's obviously abnormal, you'll be able to say that, or you can just put in a few values that you've measured. You've been taught how to measure this if you take an ultrasound course, and if you forget, you can just press a button, and this is how you're going to keep learning. You'll press a button, and this will just tell you, okay, now I know how to measure an M mode or a 2D. These are the things where I'm going to put, in this case, I want you to stay in 2D because it's easier for you. You're not having to move modes, you're just in one mode. You do a 2D, you put a cursor through, you measure it in both diastole and systole, and it will take care of the rest. It'll do all these calculations for you. And so now it's telling you that fractional shortening is low. So it's telling you that for this animal, and you can say this is a little bit depressed of left ventricular contractility. That's quick and that's easy for you to do. You get very used to that, and you do that within a minute. It just doesn't take very long, and you get a bonus. The bonus is it also gives you volume status because you're evaluating the left ventricle at diastole. In this case, it's normal. So we know that this dog is not volume depleted. we know he's normal bulimic. So that's very helpful. And then you have to go to a different spot, and we want to evaluate left atrial size again in 2D because it's easy to do. You get very used to doing this measurement, and now you've evaluated left atrial size. I've made it really easy. And again, you can learn off this. You can keep using the program, and then you can see that left atrial size is now increased. So um, this supports cardiac issues rather than respiratory, and this should bring us that, and we're just going to use that. It's automatically analyzing all that for us so that we can use that quickly. If this were normal, I haven't tested this, but I could test it. I'm just a little, I bet it'll just say that that's normal and doesn't support. Do we want to try that? Ooh, dicey. How about let's make it something normal? We'll make it 3 and we'll say this is normal. And what does it say? Respiratory rather than cardiac. Yay, it worked. Okay, so makes it easy. So now we've done both fast and point of care, and we've done lung ultrasound. We've looked at the heart, and this is very basic ultrasound that you're going to do on patients to get really basic information on them. And now we'll go to a basic ultrasound. So let's come back to here, and we'll keep looking at what we have. So we've gone through all this. We've looked for contractility, volume status, and left atrial size. And I've given you a tool that you can take home and use, and you can keep doing that. You can just keep using it. So ultrasound in everyday use is now the machines are portable. They're very, very good. I've used the Mindray ultrasound machine. It's very, very good. They're affordable. Ultrasound becomes very intuitive. You just do it. And then we now have AI. Oh, no, we're not talking about AI. Yes, we are talking about AI. And so AI, these lower learning barriers. It's easier for us to learn how to do all this. And this will help us. We'll always need humans to perform the scan. That may not be always, but it's certainly in a large amount of time. And I've been doing this a long time. I don't see that the scan isn't going to be able to be done by AI, but the analysis, the interpretation will be done by AI, and it's going to be much quicker. I've done 65,000 ultrasound exams, but AI has looked through millions of these exams, and they're going to be able to, whoever they are, is going to be, that tells you what AI is, will be able to generate information for us, and we'll be able to leverage that. It'll just make this a lot quicker. I wouldn't be afraid of it. In fact, I had AI generate this. I said, hey, give me a picture of a robot performing an ultrasound exam on a human. And this is what it came up with. I think all that's lovely. I think that's good. And then AI could not tell where to put the probe. You see that? I don't think that's the right place for the probe to generate that. I think that should be somewhere in there. So AI is not, I wouldn't worry about AI so much. It's the machines have come down in price. They're much more portable. We used to start with big machines like that. These new machines are absolutely beautiful, and the images they get are really beautiful. They're more affordable for in-hospital. And then this is a Mindray. I think it's an E7. I don't know that, but I've used this machine, and the portable machines are wonderful. They're really good. So I'm just cycling back and getting back to where we were, and we're going to go the big 5, and we're looking at liver there. You'll be able to see gallbladder. This is all really easy to do. I do this every day, all day, because I'm examining abdomens as well as hearts. You'll be able to look at spleen and learn about looking at spleens. Here's a kidney with dilated renal pelvis, and that's pretty obvious. And then looking at the urinary bladder as well. And you'll be taught how to do this. So I'm not going to, this is telling you where you're going with all this. So if we go back to EchoBat, now I'm just going to keep it in here. We're looking at the liver, and we've got moderate hepatomegaly with rounded lobes. the echogenicity is normal, but the texture is a little off. And so EchoVet, if you use it, you'll be able to see all the possibilities that are possible with a diffuse lesion problem or a focal lesion. And everything that's really in veterinary medicine is in here. Yeah, there's always weird stuff that you can't really take care of, but 99% of anything you would want to read in a ultrasound textbook or get taught is in here, and then you can then just use that. So this is vacuolar hepatopathy due to a liver. So I'm encouraging you to learn with the tool that is being provided is all I'm doing. And again, just keep reusing that same exam. You will never get charged because it's free for the first 10. And you can just keep using those exams to learn from. You can't do more reports because it locks the patient in for you. So here's the stuff you're going to be able to see. Free fluid, we're near the back end of the animal. There's the urinary bladder and there's free fluid there. Fluid is dark. We can look for bladder stones. These are stones because it's echodense and ultrasound isn't penetrating. There's far field attenuation. And this is another stone, far field attenuation, because the ultrasound beam can't go through that stone that tells you that's echodense. You can see hepatic texture. So this is clearly a bright liver. And so you're able to say the liver texture and echogenicity is not correct. You can look at renal architecture with our pelvic dilation example. And then you can look for GI motility as well. So this is all really quick. This is what you'll do, what you would do on an everyday basis. But then once you just get into the beyond the basics, we start getting into more advanced abdominal ultrasound. And so now we add on, and remember this is all additive. So we've got the big five: liver, biliary, gallbladder, spleen, urinary tract, kidney, and bladder. And then we're adding on gastrointestinal, adrenals, pancreas, and reproductive. And you would start taking courses, or you just start looking at that on your own. If you use EchoVet, you can go through each of these and find out everything that is present in a full abdominal ultrasound. So let me just show that to you, because I'll show you the kind of how that works on a practical basis. So we just went through the basic big five. So we've got a general, does it have ascites, essentially, is what I'm looking for here. Liver and biliary, we've got both of those. We're able to report that really quickly or figure out what are all the possibilities I could have. These are the possibilities with diffuse lesions. So it's a teaching tool for you, and you can just keep it up and go look at it. And I'll build more and more of those teaching aids that you just saw. I'll build more of those because I like doing it. And then we're looking at spleen and urinary tract, and we've got to divide that up into the bladder, left and right kidneys. So this shows you everything that you can learn. And if you learn all this, you will know more about abdominal ultrasound than I know by far. Okay, so that is a basic, and now we're going to a full abdominal ultrasound. The way I do this is I'm just going to set everything to normal. So I set everything to normal because there is only a few things, and I'll just take out what are abnormal. I did not look at the adrenals, but I'm going to say I did because I don't look at adrenals. And then I'm just going to go to the liver, and I'm saying, yeah, we said that this was Cushing's, and then we're going to go to the adrenals, and we say, well, the right side adrenal, left adrenal is pretty normal, and then the right side adrenal is abnormal. It's big. It's really big. And so if we look at that, we're going to say, well, it's going to tell us all the possibilities that we have for adrenals. So this is, again, is a
Perfect.
teaching tool. Okay. So I'm just alerting you that there's a way forward for you. This also reports everything for you as well. You can generate reports for it. So we've been doing all this along the way, and it's just been generating a report for us as we've been going. And we've got a full report, and then with everything, and that was just automatic. I didn't have to do anything to make that report happen. We're going to turn towards the heart here in just a second. Okay, so that's so we've pretty much done abdominal, and let's see where we're going here. So, what I think it's good. We can't look at everything every time, although we look at more and more things just as we're better at doing this. And you'll build your habits doing fast and focused exams. And so here's a golden. He's presenting for collapse, and we did a fast exam, and he had fluid in his belly. And then we found this big cavitary splenic mass, and that's hemangiosarcoma. And then we ultrasounded his liver to see if he had Mets or not. And that guides us to what we're going to do clinically and what we're going to tell the client, because we know that most of these are hemangiosarcoma, but some of them are hemangioma that we don't know till we take the spleen out. If we see Mets in the liver, which you can see pretty easily, then you know it's not hemangioma. You know it guides you with what you're going to tell your client. All right. We're going to turn now to echocardiography. I find echocardiography simpler than abdominal because I don't have to move my transducer. So everything is pretty quick, but I understand that echocardiography is a little bit daunting for folks. And then I think this is what you should aim for. Just aim to be able to move through a basic examination efficiently. Shouldn't take you that long to do it. You should be able to obtain basic measurements and analyze those and easily recognize common conditions. That's what you're aiming for. And you'll have to either study that on your own or take courses. And then you translate that to something you can do something about. So a dog comes in and he's got a murmur and you need to do a dental on this dog. To me, I think that we should be able to help you to be able to ultrasound that dog, do an echocardiogram that says, well, his left atrium is not very big. He's got a little bit of mitral regurgitation, and left atrial size is not very big. This is a dog I can safely do a dental on. Oh, look at that. That is horrible. That is a huge left atrium. It doesn't look normal to me. I'm going to refer that before I anesthetize that dog. I'm not going to subject that dog without having more information. I think that that's a really reasonable thing to be able to do. And if you take courses, you'll probably have to take a course. You're going to do it from the right parasternal, and you're going to look at these kind of typical views that we do in long axis. And then you'll also have short axis views. I know this looks complicated, but it is not. It's slight angulation. We stayed in the exact same place, and we're just doing slight angulation to obtain all the views that we really need. We can go to the left side as well, and you'll be taught how to do this. And then there's left heart views that are really useful as well. You don't need every view to make clinical decisions. What can you see quickly? Remember, I'm really trying to make this a daily where this is a stethoscope. You pick up a probe instead of a stethoscope. What are you looking for? Well, you want the left walls to be symmetric with normal function, and the right side shouldn't be huge. It should be about the third the size of the left side. Contractility should be good. If you should be able to measure a fractional shortening to know what contractility is. You should be able to say that the left atrium is enlarged or not enlarged, and then pericardial effusion versus cardiomyopathy. And this is really easy, and this is what ultrasound was first designed for. If you put a stethoscope on an animal, you just can't tell the difference. It's just not really possible. They both have poor pulses. The stethoscope is going to kind of be muffled, And here you can easily see pericardial effusion, and the right side is tamponaded down. This is a thick little heart because it's just not getting fluid, not getting blood into it, so everything is thickened down. And this is clearly depressed, dilated cardiomyopathy with depressed function and a huge left atrium. So you did that in a nanosecond. Okay, it's not a nanosecond, it's more. And then there's advanced things that one can do, Doppler flow, and and then you'll measure things by M mode, and you'll know when to refer for a complete echo. But I think you should be doing echoes and get facile at them. I think that that is a reasonable request, and I'll show you some of this, of course. And these are the types of echocardiography that you can do. So we can do a 2D image. We do M mode if we put an ice pick view and scroll that over time. This is the classic way of doing measurements, and still a very good way of doing measurements. So it's and then we can do measurements in 2D as well. Dogs, we do a 2D of their aorta left atrium. We often do an M mode of their left ventricle. We do color Doppler. You can just press the color button and you can see how much leak they have from their left ventricle to their left atrium. And we can see, oh, he's got severe mitral insufficiency. That took a press of a button and just look at it. It's really intuitive there. And then you can start doing pulsed and continuous wave Doppler studies. So, and that's more advanced. Let's come out
Dr.
of here
Paul,
and just,
we have
yeah,
one question on the Q&A.
yeah.
So, the great talk says, I just want to know if by your experience and a Nubian ultrasound here, with the most basic ultrasound equipment can make good, fast diagnosis, or would it be better to invest in a machine that's a bit more expensive?
I think in order to do, you need a linear probe to do abdominal ultrasound pretty well. The curvilinear probes work pretty well with abdominal, and you can tell me I mean, you're the expert in the equipment thing. I would defer to you. And I think you need a phased array probe to be able to do good cardiac. You just can't get in between the ribs very well if you don't have a phased array probe that will fit between ribs. So I do think that as you get better, you will want to invest. Maybe the machine doesn't need to be changed out, but you need to invest in an additional probe to do a good job. I think most cardiac ultrasound at the level that is reasonable can be done with one probe, a five megahertz probe. Um, Once you start doing a lot of cats, you'll want a 7.5. And if you do a lot of big dogs, really giant dogs, you'll want the 3.5. So did I answer that question?
That's a good answer, but and I do agree. But as we know, we do get what we pay for. So when you do invest in something, maybe you don't have to get a $50,000 piece of equipment. I mean, our E7 is close to half of that, or but you're getting great, better penetration, better color sensitivity, a lot more response time to get your images quicker, especially for these animals that we can't, we're wanting to be efficient. So it does make sense but be reasonable, right? I think that you can always grow into it. And like you said, you can always add more transducers. That's a great solution as well.
Yeah,
Okay, sorry. Thank
I agree. And anything that's in the newer machines are remarkable. And you want a good machine. You want to do good work. And you'll make that money back so quickly. It'll become a profit center in a very short amount of time. So I consider this as the new dentistry. This is a profit center that has been overlooked. It's done. It'll be done so fast and so often that one will it will become a true profit center, just like dentistry is now. Good. All right, I'm gonna come
Excellent.
back. Remember we did thoracic and we did basic, and we just had I've provided you with a thing of basic measurements to take. These are basic things, and there's a way. I just press the button, and it's just giving you a reminder of how to get these values. So this is a teaching tool, really. And if you press this was M mode, this is 2D, and if you just press the button, it's a teaching tool for you, and you can use it to uh, know where you're at with all this. And then these are the basic measurements. And then the nice thing about this thing is I use this all the time. I'll just set everything to normal. So I just made this whole dog normal. And then I'm going to take those measurements. I have to take responsibility for it. And it analyzed all that for me automatically. And then I'm just going to change the things that are subjective. And here's everything you can say about a mitral valve. In this case, I'm just going to make it moderately thickened. And then here's the things that you should be looking for. Effusions, we've done that. Is there thrombi? Did you look at hepatic veins? Are they increased or not? So this is all teaching tools for you. And I'm not going to go into how to do echocardiograms, not the point of this talk, but I'm telling you there's a tool ready for you to learn a lot of things about, does this animal have dynamic outflow obstruction, and you would learn about systolic anterior motion of the mitral valve in cats. So I'm just showing you some of that. We looked at the complete abdominal already. There's a complete thoracic that if you want to learn something about echocardiography, it is in here, and it will do everything that one might want to do. You can see that M mode and 2D are very similar, except in M mode, there's some things you can measure off the mitral and tricuspid valves. In 2D, you measure the right atrium. These are not things I'm teaching you, but you can do very fancy things. And there's teaching tools. If you want to learn about Simpsons, there's a teaching tool for you to learn about Simpsons. Something you don't, that's just advanced. This is all advanced kind of stuff. So I'm showing you that you've got a free tool to take home with you. So we'll finish up here, and the what's the future hold? These machines are better and better. They're becoming smaller and smaller. I don't. The handheld probes might be good for looking at fluid. They're certainly not good enough for doing cardiac. You might be able to get contractility, but it's coming. It's coming. AI is coming, and some of the machines are putting AI in there, and it's a remarkable thing. I just gave a talk at the American Society of Echocardiography and got to look at a lot of machines, and the AI capabilities is going to be remarkable. And because this is pattern based and this is measurement based, it's very positioned to where it will analyze and interpret things for us, and do a good job in the future. There's mentorship and teleultrasound for those of you that want help with that, and ultrasound literacy as a core clinical um, ability, I think, is where we're going. This is not really replacing a stethoscope. It's the next evolution about it. I love this. Start small, scan daily, learn visually. If you can do this. It's pretty easy, and I think we're set. And we'll take some questions if you have them, or Jennifer has questions for me
Like
that I
here.
could answer.
Yeah, another question on the Q&A. So it says, just forgive the indiscretion, but when we say fast ultrasound exam, how much would this charge the client, or any suggestions on that? Just as a fellow DVM.
The average, no, it's a great question, and I'm fine with it. The average ultrasound fee around the nation is something like $300 for an abdominal ultrasound. So, a specialist will charge more than that, $375. If you're doing a fast exam and you charge, I don't think fast exams should be free. And so I've encouraged my group, the emergency part of my group, to charge, if they can charge $100 for that, you're charging $300 for a set of x-rays. If you charge 100, 150, $200 for a fast exam to know that there's effusions, whether it's pleural or pericardial or abdominal, that's not unreasonable. You just save that client a huge amount of money by knowing what's going on with their animal. So I'm not shy about charging for what we do. This should be a profit center for us, and we should charge for our abilities and you guys spending the time here to learn this stuff and taking the time to try and learn from it. Clients don't pay me for the time I take to scan their animal. They're paying me for the 40 years I've spent learning all this. And you too, I think you should be paid for what you do.
I absolutely agree. And you're investing in great equipment. I mean, I always say if that transducer touches the body, you should be reimbursed with something. So, even a little bladder scan, I don't care if you're doing $30, $50, but every time,
Yeah.
you deserve that.
Yeah.
And even if your tech is helping you, you are still investing in your staff too. So
Yeah,
that's great.
I'm
Um,
with you.
one more question here. Do you have any tips on how to explain to the patients and families about the scope and limitation of FAST or POCUS? In my experience, sometimes the communication is difficult because they expect more than I'm really able to do as a non-sonographer yet.
I would just leave it that I'm obtaining basic information and that I'm not trained as a specialist, but I have done ultrasound and I'm going even negative information is good information. I I I totally relate to that because when I first started ultrasound, I bought an old machine. I was the only one in Southern California to be doing ultrasound, and people heard about that, and it was just M mode. That's all it did. And I would say, bring them in. I'm going to do it for free. And if I learn something, I'm going to charge you. If I can't see something I'm not learning, I didn't charge. And I charged a small amount. But then I started charging more. I said, I'm better at it now. And I was more confident in what I was doing. And I came off. I just said, I'm confident that I've given you some information that might be helpful. I think charge accordingly and be straight up here. I'm not boarded in this, and there just FYI, there is no requirement in veterinary medicine that you have to be boarded in ultrasound to perform ultrasound. We're so, I think that's good for our profession, quite frankly. I don't think everything needs to come to a cardiologist or a radiologist. If you talk to a young cardiologist or radiologist, they might disagree because they still think they want to do all these ultrasounds, but I can't do all the ultrasounds that I can't look at all the mitral regurgitation murmur dogs that are out there. And I think they would do well to have an ultrasound so you know when to put them on pimobendin or not. That's a long-winded answer to just be straight up with clients and um, let them know your particular abilities.
I absolutely agree as I get to see a lot of different clinics throughout the whole nation. And I agree. You maybe feel comfortable with a $20 fee, but that will be a short finite time because the more you start putting the transducer on the body, the more you start scanning, the more normals you see, the more confidence you have, and you will recognize those abnormals. And you absolutely should be charging, and you will get to a point where you will not be saying, I'm not a specialist. You know that you have great equipment and great knowledge and confidence in that. So
Yep.
yeah.
Thank
And
you all. I appreciate you, all of you, for joining us and taking the time.
I really appreciate you too. I really your knowledge and your time, and we are just so lucky to all have amazing doctors that want to help us grow and support better medicine. Um, Please follow the social media. You've got a little QR code here, and we'll be giving away some prizes. They'll reach out to you directly. And do know that the CE certificates will be emailed within about a week. So give a little grace. Those will come right from CSU. So thank you, everyone. Have a wonderful rest of the week. Take care and look out for each other.